So let me now quickly record the last part of my HIV series. Let me complete that series now quickly. I should actually be doing other things. I should be studying for a little test in palliative care, but the series seems so important to me that I should continue. That I should finish it now. First, I'd like to apologize because I somewhat ridiculed that study, or the measurement used by the researchers who did the vaginal shape study. I ridiculed it because they used an Erlenmeyer flask in order to measure the caliber of the vaginal introitus, but they actually don't deserve so much ridicule. Richard Lynn deserves ridicule much more because of his racism, but the study about vaginal shapes was not racist in nature or white supremacist in nature. Also, I think even all the authors of the study were women, and they did it in order to make instruments for brachytherapy, that is radiation therapy for cervix cancer. They did it in order to make better instruments for radiation therapy for women of different ethnic groups, so that the instruments for brachytherapy, radiation within the vagina, that is, they made it with the aim so that these instruments can fit the women who receive that therapy better, or also for I think pessaries that have a better fit for women of different ethnic origin. So I apologize for making fun about the Erlenmeyer flask. And now also that last part now will be about, very briefly, will be about preventing the spread of HIV in Africa. In part 3 out of 4 in the last video I tried to clarify what might cause it in Africa, what might cause this enormous spread in Africa, and in this part I would like to clarify how the spread, based on the causes I discussed, can be diminished, can be maybe even stopped. Now, the measures or the methods for achieving that are, as I said, quite similar to the measures for MSM in the first world, and you can also refer to, so I can also refer you to that video for details. You can somehow derive the measures from the methods that I discussed in the part 2 out of 4 in the MSM video. The main method is to prevent trauma, bleeding or pain during sex, and thus reducing the entry or the entry mechanism of the virus. Now, but here, let me start by telling you a little story. Let me introduce these measures by telling a little story about a study, or about studies that have been done about prostitutes or female sex workers in Kenya who were thought to be immune to HIV. There have been a lot of, they call it, highly exposed, persistently seronegative subjects or patients. The researchers called these prostitutes highly exposed but persistingly seronegative subjects that were thought to be immune to the disease, and many still seem to be immune, but it turned out that 11 of these sex workers lost their immunity to HIV. And this story is particularly cute if my hypothesis about the transmission of HIV in Africa should be true. If my hypothesis is true, this story and the interpretation of that story is really cute, because now it turned out 11 of these women, 11 of these prostitutes, who were thought to be immune to catching HIV, highly exposed to people who are HIV positive in their work, and now 11 of these previously thought to be immune people caught the disease. And now comes the joke, or the fun part. All of these women lost their immunity after they left business, or when they took breaks from their business. that lasted for two months or even longer. And I would explain it quite simply again, like this. When they were in work, when they worked as prostitutes, their vagina was dilated regularly and kept its width because of regular copulation. The researchers also remarked that the association of HIV seroconversion, that is, becoming HIV positive, with reduced sex work seems initially counterintuitive, but it might be compatible with the loss or diminution of HIV-specific cytotoxic T lymphocytes in the absence of ongoing antigenic stimulation, etc., etc. So they admitted that it is actually counterintuitive. But I think, according to my explanation, it's not counterintuitive. When they reduced sex work, when they took breaks during intercourses, longer breaks, their vagina, which had been loose and wide, became narrower, and so was vulnerable again to larger tears that might have even bled a little bit. I think bleeding or tearing or even pain during sex is one of the last taboo subjects as far as the details of sex are concerned. Kinsey and all the other people during the sexual revolution, when people started to talk about sex, they did talk about how much sex people have, who they have sex with, how often they do it, and so on. But they did not talk about the actual details of sex, how they performed it, how it went, and so on. And this might be, as I said in the last video, I think the success strategy of the HIV virus. This is why it can survive in a niche or in a subpopulation, in a subpart of the human population. This is the success strategy of HIV, in my opinion. So now, also I should mention, in another study, or in an earlier study about these prostitutes, they found, this also confirms my explanation in a way, there were prostitutes that seroconverted and did not seroconvert, so were thought to be immune. And they found that practicing prostitution, being a sex worker, already in the time of 1984 till 93, 1984 till 1983, that had a protection effect. That was protective against catching HIV, whereas women who started prostitution in 1994 had a higher risk of seroconverting, so had a higher risk of becoming HIV positive. And of course, my explanation again would be, in the 1980s, that was the time when HIV became epidemic or pandemic in Africa. It was present in the 1970s already, but the disease started to become an epidemic or a pandemic in the early 1980s. And so the prostitutes that started their business in the 1980s already, they became loose, became wide in 1980, in the 1980s already, and so they were protected. They did not have so many tears, so many paper cuts in their vaginas, so many instances of small bleeding. Whereas those who entered prostitution in the 90s, in 1994, here it says, they had their risk of becoming HIV positive was increased 100-fold in comparison with the prostitutes that started in the 80s already. And this is because, their vagina experienced regular dilation, or a first regular dilation, with possibly tears and so on, during the 90s, when HIV AIDS was already an epidemic, a pandemic in the South African continent. So again, this confirms my hypothesis. What also confirms my hypothesis is the fact that in Africa, traditionally, women are said to have used instruments for dilating the vagina before birth. There are wooden balloons or spheres that they put in the vaginas before birth in order to reduce pain during birth. And initially I thought, then they should be experienced with widening their vaginas, they should be familiar with the organ and so on and so on. But then the interesting thought came to my mind that this is in a way analogous to the use of poppers in MSM in the privileged countries. My hypothesis there was that men using poppers use it because of a need, because they have pain during sex, because they are too tight. Men who are not too tight, men whose anus is wide, don't have the idea to use poppers at all. And this is could also be the explanation that traditionally women used these instruments before birth, because their vaginas were relatively too tight, too narrow, much too narrow, so that during birth there would be tears of a very large measure. There would be very large, very traumatic tears during birth if they didn't use these instruments. So it was also a deep need to use these instruments. Another thought that confirms my thesis in a way is the theory that in Africa HIV/AIDS is spread because of the working conditions there, because men spend time working in cities or working in remote areas for 2 months in mines and then return to their wives at home. They catch the virus from local prostitutes where they work, or from other men, from sexual contacts with other men. After all, I read reports about these working conditions there, and the men usually sleep in rooms with 20 other men, and so male to male sexual contact in these settings is actually quite probable, just as in the army, in boarding schools and in prisons, etc. So they catch the virus there where they work, and they return to their wives after 2 months, and the wife, as women sometimes are, they have been faithful, did not have intercourse during these 2 months, and so their vagina became narrow. The epithelium lost its width somehow because it didn't experience regular dilation, and so it was more prone to tears, etc., paper cuts, maybe even minor bleeding, and they caught it from the men. So that also fits the working theory. People who say that working conditions are responsible for the spread of HIV in Africa, also this factor is explained within my hypothesis. What is really cute about this finding about the prostitutes is that the researchers, or here is a report about it. I'm also giving you the bibliographical information on the study. One of them is even freely available. You don't have to have a subscription to the scientific journal. You can get it. And Sarah Rowland Jones, who was involved in one of the studies, this is quite cute if I am right. She said that this finding that the prostitutes who left work for a few months had been infected, this can be explained in the following way. She said, this implies that to maintain immunity you need to have continual exposure to the virus. I find this is extraordinarily cute if I am right. So how can you prevent trauma, bleeding, pain? You can prevent that by having regular intercourse, by having your vagina regularly dilated so that it stays wide. Maybe blacks tend to a vagina that is, well, firstly, naturally, anatomically tighter, at least at the entry. It also has a different shape. Some 40% of black vaginas are maybe narrower, or not narrower. They are wide, but they may be slim in the anterior-posterior distance. That was the pumpkin seed shape that these researchers about vaginal shape found. So by having regular dilation of your vagina, you can prevent bleeding, trauma, etc., and so prevent infection. If you don't have a partner, self-dilate. When you had birth, when you give birth, wait till the wounds from birth are healed before having intercourse, or only have sex with men you are sure are seronegative as far as HIV is concerned. This is also interesting. You can get HIV because the seminal fluid can be kept moist or can be kept airtight under the foreskin. You can even get HIV from a man who is not HIV positive, but who has semen, who has seminal fluid under his foreskin from another man, maybe from the vagina of another woman. There was some HIV positive semen, some semen with HIV virus, and he took that seminal fluid from the woman's vagina, and he then transferred that semen to his other woman. So it is theoretically possible that you can get infected with HIV by a man who does not himself have it, or who is not himself HIV positive. This is also what could explain the benefit of circumcision in HIV transmission. But as I said, simply wash. You don't have to be cut, really. This would actually be, I think this would be a good deal, because my next measure, or the next prevention method, would be for virgins to widen their hymen themselves. This also prevents pain when you have your first intercourse. Tear your hymen yourselves. Don't let the men do it, because it will be somewhat traumatic if it's really tight. They don't know how to do it softly, or sometimes it's simply not possible, because it's actually not their fault, because it's the circumference of the skin or of the hymen simply sometimes does not allow the entry of a penis without some small tears. So experiment with your hymen, dilate it yourself. I know that this is something of a disappointment for most men. To quote literature, or to make a cultural reference again, I referred to Moby Dick already, to Salvador Dali and other artists. I like these cultural references. So in James Joyce's A Portrait of the Artist as a Young Man, they talk about moral issues. The young artist there, the aspiring artist in school, talks to his buddy about moral issues, and the friend asks Stephen, who is the hero of the novel, "Tell me, for example, would you deflower a virgin?" And Stephen then answers, or he says, "Excuse me," Stephen said politely, "is that not the ambition of most young gentlemen?" I understand that it is fun for most men to tear that thing open, to deflower that flower, to make her scream, or to leave your mark on that pussy. This seems to be an extraordinary indulgence, but unfortunately it's one of those a tiny bit less awesome things that you can do for your longevity and that of others. So let's make a deal here, guys in the south of Africa. Let's make a deal here. You can keep your foreskin, get rid of these circumcision campaigns, of these voluntary circumcision campaigns. Say I wash my dick and I see to it that there is no semen present, etc., etc., and I go to the doctor when I have a sore or an ulcer on my dick. But let me keep my foreskin. You keep your foreskin, and you let your chicks in return tear their hymen themselves, or to get wide, and let them heal. Let the widen the hymen slowly, so that there are maybe some small little cuts, and these small little cuts you dilate them a little bit. Wait till the entry of the vagina is wide enough to accommodate a penis, and then you are less prone to catching HIV. You have a longer life, you can enjoy sex more, etc., etc. So these would be also, of course, the same as what I said in the MSM video. If you have pain during intercourse, tell him to stop. No matter how much richer he is, no matter how much more attractive he is, no matter how much brighter he is, no matter how much hornier he is, your vagina does not deserve to be treated in that way. It doesn't deserve to tear, and you don't deserve to have pain. Tell him to stop. And guys, stop once she screams too much like an animal, or once she starts biting on the pillow because of pain. Also, maybe, though I'm not sure about the importance of that, but maybe also when you have a headache or other pain, don't take aspirin. Aspirin makes your blood thinner. It makes bleeding more likely. Use Tylenol or ibuprofen. I don't know what the English or American brand name for that is. Let me check. Use other analgesic drugs. Advil, Motrin, Nurofen, Brufen, Nuprin, but don't use aspirin. If you take it, your blood will be thinner for about a week.